This analysis, which represents a retrospective multi-center analysis of patients with non-Hodgkin lymphoma that were candidates for an allogeneic stem cell transplantation and that received bispecific monoclonal antibodies before allogeneic stem cell transplant. The rationale behind this analysis is that when we consider allogeneic stem cell transplantation in non-Hodgkin lymphoma nowadays, we are usually talking about a heavily pretreated and relapsed refractory population of patients, and novel strategies to try to put the patient into a complete remission before allogeneic stem cell transplantation seem an interesting option. And of course, one of the new treatment strategies that have been tested in the setting of prospective clinical trials are bispecific monoclonal antibodies, and that are really effective drugs. With the capacity to achieve a significant proportion of overall responses and complete remissions with quite a safe toxicity profile, and they might represent an interesting option to put these patients in complete remission before allogeneic stem cell transplantation. In this analysis, what we were able to demonstrate was that the long-term outcome of patients being allografted after having received bispecific monoclonal antibodies was not modified by the prior administration of these drugs. Non-relapse mortality was around 15 to 20%. Non-relapse rate, after transplant was really very low, lower than 5%, and a significant proportion of patients were alive and disease-free after allogeneic stem cell transplantation. We did not observe an increased incidence of the classically related toxicities to allogeneic stem cell transplantation just because of the prior administration of bispecific monoclonal antibodies, and hematological recovery was quite similar in this group of patients to what we know from patients being treated with an allogeneic stem cell transplantation that had been bridged to the allo transplant with other treatment strategy. So basically the summary is that bispecific monoclonal antibodies could represent an attractive option to bridge patients into an allogeneic stem cell transplantation without modifying the toxicity profile of the allogeneic stem cell transplantation itself.